Thank you. So here we are, y'all, in session 15. We have spent so many weeks together at this point, and we find ourselves at our final lecture with the topic Healthcare as a Fugitive Activity. And it's funny because I was talking with my brother earlier today, and I shared with him like, "Oh, we've got our final class of the semester. It's called Healthcare as a Fugitive Activity." He was like, "What? Like, what do you mean by that? What are you talking about?" And of course, I had to give him the whole shebang, right? I wanted to describe to him the conversations that we've been having since January in this semester. I share with him that our theme for the semester is disenfranchisement, fugitivity, and charting a path towards freedom. And I asked him, when you hear the word fugitive or fugitivity, like, what comes to your mind? What do you think about, right? And who taught you that? Where did you get that understanding of what that term means? And so I just really hope that in the conversation that we have today, as our presenters share about their work, their healthcare work, and the ways that they are working to chart a path towards freedom, I hope that we will all just continue to really question this concept of fugitivity and really continue to like peel back the layers of what exactly does this term mean? Where did our initial understandings of this term come from? What does it mean for who has power, who makes the rules, who breaks the rules, right? Like, I just want to encourage you all to be percolating on these concepts and really questioning them as we listen to our speakers today. So, as usual, you all know how things go in here. As our presenters are talking, please share your comments and reflections in the chat. And our lovely course TAs will be gathering all of that, and we will have plenty of time towards the end of our session for your questions and for a more robust discussion with our presenters. So please, in the chat or using your emojis, give our presenters a warm welcome. And without further ado, Caesar, the virtual floor is yours.
Thank you so much, Dr. Ford. Appreciate you and appreciate everyone who showed up today for our last class, last chance for us to be in community in the spring. And here we are rounding those 100 days. Remember when we started putting this together and we talked about how the course was going to start basically right around the inauguration and then end right around the 100 days. And it has been a roller coaster ride, that's for sure. Yeah, I'm not going to belabor that point too much. I want to get us started. So, I believe Tammy is going to kick us off. We each have different topics that we're going to cover, but they're all really about the fact that here we are, public health folks, healthcare folks, just trying to live, just trying to do what we can to keep each other safe. And we're doing this now through in a climate where increasingly our activities are very much fugitive, and there's a lot of different ways this has like impacted us and it shows up in our lives. And so we're going to talk about different things, and Tammy's going to kick us off. So please welcome Tammy as we're very warmly, and I'm very glad she's here.
Thank you, Caesar. I'm gonna go ahead and start sharing my screen because as we talked about before, we are slide people. I don't know if that's like a millennial thing, um, but
I don't know, but I'm embracing it.
you know what? Yeah. Okay, wait. I'm having a little trouble. Give me 1 second. Let me figure.
Editing my slides this afternoon because there was breaking news about masks yet again, So we'll get into that later, but just want to give you all a little preview. Got some calls to action at the end too.
Okay,
Someone,
this hasn't ever happened to me before, but apparently I have to give security access to Zoom. I'm sorry, I don't know
Mm.
what's going on.
do you want, I don't know how you have your slides, but maybe if it's like a link, I could share it for you
Yeah,
or something.
here I'll go ahead and copy this link. I'll throw it in the chat if that's okay.
Yes.
All right. Sorry, I don't know what that's about. I've never had an issue doing
So you can just tell me next slide.
that. Perfect. Okay. Thank you so much for this warm welcome, and for having us to talk about this really important topic. I'm gonna kind of breeze through the first half of this. There is a lot to be said about the topic today, and I kind of debated internally what would be the most useful for you all to know as students of fugitivity and public health workers, and people who are kind of fighting the good fight. And ultimately decided that the topic that was closest to my heart that I've been working on kind of most consistently is the idea of healthcare workers as human rights defenders, specific to the work that I have engaged in Gaza over the last year and a half. So we can move to the next slide. Um, just a few fast facts because I know not everybody has been paying attention to the same degree that maybe some of us who are more involved have. But unless you've been living under a rock for the last 18 months, you have probably noticed that Gaza is in the news a lot. So the Gaza Strip is a part of the occupied Palestinian territories. We're not going to get too much into the details, but the UN and the international courts all acknowledge Gaza as part of the occupied Palestinian territories. We say occupied because it is currently occupied by Israel. The population of Gaza, so Gaza, as you can see, shares a land border with Egypt, and then the rest of the land borders with Israel, part of the occupied, which is occupying that territory right now. The Gaza Strip is about the size of Metro Chicago, a little bit smaller, and contains about 2.1 million people. 70% of those folks are refugees from other parts of occupied Palestine. During the Nakba of 1948, the 750,000 people were forcibly displaced from other villages in Palestine. And so the current residents of Gaza, 70% of them are actually from the neighboring towns of Gaza. Um, the kind of going through very briefly the history, the last 30 years of Gaza's history has really been marked by the concept of isolation and de-development. It has been under military occupation and control since 2007. Which essentially means that Israel controls the land, air, and sea borders of Gaza, controls what goes in and out. This is pre-October 2023. Controls what goes in and out. Um, the government of Gaza and the education and finance sectors of Gaza have not been allowed to develop. In fact, they have been de-developed over this process of siege and occupation. So what that means is there was no free trade in Gaza. Travel was limited. Personnel moving back and forth was limited. And for my purposes, what I'm really going to be focusing on is healthcare. So in 2009, kind of going through into more recent history. In 2009, there was a UN fact-finding mission that was studying this process of de-development of Gaza and how Israel has imposed restrictions to make that happen. And they concluded that the purpose was to, quote, punish, humiliate, and terrorize the civilian population, radically diminish its local economic capacity, and force upon it an ever-increasing sense of dependency and vulnerability. So in 2007, Israel obviously intensified its military blockade and restrictions. By 2012, a UN commission concluded that Gaza would not be livable by 2020 unless there were Herculean efforts to develop it in health, education, energy, water, and sanitation. And obviously, by the time 2019 came around, there was a UN commission that concluded that the unlivable situations were already in place. So all of this kind of before current events, just to kind of contextualize all of that for you guys. We can go to the next slide. So specific to our topic today, the health sector was a particular focus of Israeli restrictions and de-development. So in 2012, there were reports that more than 40% of essential drug items and 50% of medical consumables were out of stock. And on top of kind of the restrictions or this kind of indirect way of punishing the healthcare system and destabilizing it, what began in 2008 and 2009 was Operation Cast Lead, which was led by Israel. It's part of Israel's kind of continuous effort to quote unquote mow the lawn. That is a statement or a figure of speech used by Israeli cabinet officials that describes the strategy with regards to Gaza. Every few years, they launch a military attack, kill thousands of people, devastate some infrastructure, and call it mowing the lawn in an attempt to control the civilian population. So Operation Cast Lead was one of many operations over the last couple of decades that intended to do just that. But we see that in Operation Cast Lead, what begins is direct attacks on Gaza's healthcare infrastructure. And then all subsequent attacks after that kind of continued this pattern. The picture that you have on your screen is a picture of two women who were participating in the the Great March of Return, which was a nonviolent protest in 2018 and 2019, basically a year-long nonviolent protest in which every week Gazans would march towards the fence. The fence between Gaza and Israel, the fence that essentially is blocking their freedom of movement. And during this particular kind of nonviolent effort on the part of the Palestinians, a lot of healthcare workers were being targeted, paramedics. We were seeing things like a deliberate strategy to shoot people in the leg or in the knee in an attempt to incapacitate them for life. We can go to the next slide. Sorry, this is just kind of like breezing through. I could talk about this for a full 2-hour lecture, and maybe someday I'll have to just to like properly contextualize it. But I want to kind of fast forward to October of 2023. After the events of October 7th, Israel decided to impose a total siege on Gaza as a way to collectively punish 2.1 million people. So it begins halting delivery of electricity, water, supplies, all of the humanitarian aid that was previously coming in to Gaza, which was about 300 trucks of humanitarian aid a day, were now halted. And it begins sort of this massive aerial campaign of destruction. The result of which is that 69% of Gaza is now deemed under a red zone or not fit for Palestinians to be in as a result of either military occupation or surveillance on the part of Israel. And the establishment of these kind of this laughable concept of a safe zone inside Gaza, which is repeatedly being bombed. So this massive campaign of destruction begins, and it's specifically, by the time October, the second week of October rolls around, we begin to see kind of this really deliberate effort at annihilating the healthcare system. We can go to the next slide. So this first picture is October 17th, 2023. This is a press conference that was held outside of Al Ahli Baptist Hospital. The Baptist hospital was hit by a missile, an Israeli missile, and 500 people were killed. That includes patients, doctors, healthcare workers, and people that were sheltering inside the hospital because the hospital was deemed to be a safe place. And this massive aerial bombardment campaign and the carpet bombing that was being carried out meant that most of Gaza was not safe. And so people started sheltering in hospitals. The physician you see at the podium, his name is Dr. Ghassan Abu Sitta. He is a renowned British Palestinian surgeon who was operating in Al Ahli Hospital at the time. And watching this press conference, I personally was a very life-shattering and earth-shattering experience for me because it really began to bring home the idea that there is no safe place in Gaza and that people or international human rights law typically protects places like hospitals, healthcare workers, health delivery services. And this was kind of the beginning of the end. And many people that I've spoken to in Gaza have sort of pointed this out as the moment that they knew that this was very different from any previous military assault that Israel had carried out against Gaza. What we saw at the time was a lot of speculation about whether or not Israel had actually hit the hospital. There was a lot of manufactured consent in the media for absolving the crime that Israel carried out at the time against this hospital. And what we saw is really essentially no accountability and no repercussions for striking a hospital. Go ahead and click. And so then this began a large-scale campaign. I guess Israel kind of tested the waters with Al Ahli Baptist Hospital, and after facing no repercussions, subsequently began to hit every hospital, nearly every hospital in Gaza. This is the surgical building of Al Shifa Hospital shortly after it was besieged, attacked, raided, and burnt. We can go ahead to the next slide. This is a picture that I took of Nasser Medical Complex. This is the largest medical center in the south of Gaza, so south of Wadi Gaza. This is a picture, a nighttime picture of the mass grave that the Israeli occupation forces created after they entered Nasser Hospital in February and March of 2024. In this mass grave, they executed healthcare workers, patients with IVs in their arms and casts on their legs, threw their bodies into this mass grave and bulldozed over them. The bodies were recovered after the Israeli forces withdrew from the hospital and caused kind of massive international outcry, but again, no real accountability. We can go ahead to the next slide. So this is the total number of attacks so far recorded in the last 18 months on healthcare facilities in Gaza, so numbering 670. And this includes hospital attacks, clinic and healthcare point attacks. Go ahead to the next. Healthcare Workers Watch is a collective that emerged after there was data coming out of Gaza that hundreds of Palestinian healthcare workers were being targeted and killed. So as of, this is obviously not an up-to-date list, but an estimate of 1,200 Palestinian healthcare workers have been killed by Israeli occupation forces. If any of you are in Chicago, some of you might recall the vigils that we held in the early months of this genocide, in which we read out the names of all of the healthcare workers who had been killed and what their occupations were: nurses, doctors, healthcare technicians, dentists, medical students. And every week the list got longer and longer and longer, and it was quite devastating to kind of hear how this was getting worse and getting intensified. And so I want to point out that it is no coincidence that this many healthcare workers have been killed, right? Not only is Israel targeting healthcare facilities, it is also targeting the workers that run these facilities, make them operational, kind of the brain power behind healthcare, right? If you want to eliminate a population's health, you eliminate the healers. And sort of this pattern of deliberate destruction has enabled the subsequent near total collapse of the healthcare sector in Gaza. Go ahead, Veronica, or Tiffany, I'm sorry. Next slide. So what does this look like for healthcare workers? So I just want to point out a couple of anecdotes here. These are stories of my colleagues that are in Gaza. The person you see over there on the left is Dr. Hammam Allo. He was a nephrologist in Gaza. His testimony went viral on a clip from Democracy Now!, in which he was speaking to the host, Amy Goodman, and she asked him, well, go seek safety somewhere. Why don't you leave? And he famously responded, if I go, who treats my patients? You think I went to medical school for 14 years so I can only think about my life and not my patients? I'm asking you, ma'am, do you think this is the reason I went to medical school, to think only about my life? This is not the reason I became a doctor. Over on the right, you see the remnants of a surgical board in which the staff were so overwhelmed within the first month of this military assault on Gaza that at some point their hospital was threatened and they had to evacuate their ORs and their emergency departments. And they left kind of a message saying, whoever stays until the end will tell the story. We did what we could. Remember us. I want to emphasize here that although these stories are tremendously heartbreaking and really difficult to grapple with, I want us to recognize that these are also acts of resistance. And so staying in a hospital that is being besieged is an act of resistance, right? It is resistance through healthcare. It is sitting and providing care to patients. I don't know that many of us could make the same choice in the same circumstances, right? But these doctors chose to stay to serve their patients, knowing that if they left, their patients would not be left with many options. The circumstances being what they are, the healthcare facilities and the healthcare collapse being what they were, there would not be many options for patients who came in sick. And so they chose to stay, and they chose to carry out their duty and perform the tasks that they were that kind of encompassed the Hippocratic Oath that we all took in medical school and in our various kind of medical professions. We can go ahead to the next. Couple more stellar examples of this. The gentleman on the left here is or was Dr. Adnan al-Bursh. He was the chief of orthopedic surgery at Shifa Hospital. Dr. Adnan al-Bursh was abducted by the Israeli military. He was tortured and killed by the Israeli in an Israeli prison. The details of his torture are terrifying and horrifying. And if you're so inclined, please go read the health workers or the Human Rights Watch report on this. I'm not going to repeat the details because I will start crying and I need to get power through the rest of this. But yeah, Dr. Adnan al-Bursh was killed for providing healthcare for his patients. Dr. Khalid al-Sir, who I've had the honor of meeting at Nasser Hospital, he is a general and trauma surgeon. He's up there on the top of the screen. He was also abducted by Israel, was in an Israeli detention facility for 5 months where he was also tortured. And then he was released uncharged, kind of released in the middle of Gaza, had to make his way back to his family. His family didn't even recognize him at the end of 5 months of torture. He went straight back to work, and he still works at Nasser Hospital. And I've had the pleasure of walking around Nasser with him and having dinner with him, and he's an extraordinary man and an extraordinary human being. And he says the same thing. Well, if I leave, who takes care of my patients? Dr. Hussam Abu Safiya is the gentleman that you see in the bed at the bottom. He is a pediatrician and was the head of Kamal Adwan Hospital, which is the hospital located in the north of Gaza. His son was killed while he was working at Kamal Adwan Hospital, thought to be in retaliation for his refusal to abandon the hospital at the request of the Israeli occupation forces. He was also shot in the leg. He was abducted when the Israelis besieged the hospital, and he is currently being held with no charges by the Israeli military. And according to his lawyer during her last visit, he is also being tortured. We can go ahead to the next slide. So as governments are refusing to intervene, NGOs begin this process of trying to deliver aid. Very, very briefly, what this process entailed was when the Rafah border was open, which is the border with Egypt, the World Health Organization began organizing convoys in December of 2023 and January of 2024. This includes medical personnel, medical supplies, and doctors. Initially, there were very few restrictions on what doctors could bring in with them. You can go ahead to the next slide. So the picture on the left over here is the van that we drove to the Rafah border from Cairo on my first mission into Gaza in March of 2024. As you can see, loaded with bags. I mean, each one of us probably brought 8 bags with us, carrying medical supplies that we knew Gaza did not have because Israel had not allowed them to enter for a period of months. So I emphasize these restrictions because the NGOs, as well-intentioned as they are and as effective as they can sometimes be, are also pressured into complying with the occupation's impositions. So you can't bring surgical supplies without advance permission. This advance permission is never given. You cannot bring certain medications without permission. This permission is never given. After the Rafah border was invaded and closed in May of 2024, all entry and exit procedures for the WHO were carried out through the Kerem Shalom crossing, which is an exclusively Israeli-controlled crossing, which means that on the second mission that I undertook in the summer of 2024, I had to go through Jordan, cross the land bridge over into the occupied West Bank, and from there escorted through Israel to the Kerem Shalom crossing. We were only allowed one bag. That's the one bag that you see pictured there on the right. This is an arbitrary requirement that the Israelis came up with, just one bag, and it was not allowed to contain medical equipment. Doctors being doctors and emergency doctors being emergency doctors, we tried to sneak in as much as possible. So in between all of the stuff I had in there, I had medical supplies snuck in, medication snuck in, and things like soap, which had also been restricted by Israel from entering. We can go to the next one. So these Israeli restrictions on the entry of healthcare workers meant that healthcare workers had to take on this role of becoming human rights observers, reporters, journalists, and documentarians. And so the second time that I entered Gaza, the primary focus became collecting evidence of war crimes and collecting evidence of violations of human rights. In particular, I focused on collecting evidence of deliberate targeting of children, which was something that was being hotly contested by the Israeli military. The picture that you see over there of the little girl in the diaper, this is a 19-month-old that was shot by a quadcopter outside of her family's tent. A 19-month-old toddles, right? They are not great at running, walking, anything like that. And we found that children became a prime target of these quadcopters. Quadcopters, for those of you who are unfamiliar, are unmanned drones that are mounted with weaponry. They can shoot projectiles, they can shoot small missiles, and they can shoot bullets. And so this is what was witnessed by folks kind of outside of the tent. Luckily, she came in and did not sustain any lasting damage. The other picture that you see over there is a bullet that is retained in the buttock of a 9-year-old boy who was also just walking outside of his tent in the Khan Yunis area. I want to point out that as a doctor, you don't get trained on how to do this. There is no class in medical school or nursing school or public health school called How to Document War Crimes and Report Them. So this is something that I had to reach out to forensics experts and legal experts to figure out how to do and how to do effectively. And so it's things like, making sure that location is on your camera roll, making sure that you download all of the metadata associated, taking meticulous notes for verification. All of these subsequently went into a drive that I shared with legal partners at the ICC and ICJ, as well as journalists who kind of rely on healthcare workers who are kind of the only people that can come in and out for testimony and for evidence and for their reporting. Go ahead to the next one. Or actually, we can go ahead and skip to the next one as well. So really, I guess the overall idea here is how healthcare has been used and attacked as part of a genocide enablement apparatus. This is really kind of what we are calling the systematic way in which Israel has carried out its genocide against the Palestinian people of Gaza. So it's things like we've already discussed, the obstruction and hindrance of international and professional condemnation, the inability to prevent Israel's assault on Palestinian medical sector, punishment of healthcare workers in Western medical institutions. If you know anything about the last year and a half, it has really been marked by repression of voices that are attempting to amplify the stories and the testimonies of our colleagues in Gaza. People have been fired for speaking publicly on this, speaking on social media about this. They've been suspended, they've had attacks, they've been doxxed, they've been censored, and this is it has particularly damaging effects on those of us who are Black, Indigenous, minority, or racialized healthcare workers. And so it has, and a key element of this and something that we've been working on with healthcare workers for Palestine is kind of not only the silencing of healthcare workers who are working on this, but also the silence of medical institutions. So things like the American Medical Association, the American Nursing Association, prominent journals refusing to publish things about genocide, refusing to publish accounts of doctors who have returned or doctors in Gaza who are reporting on all of these injuries and these attacks. So the silence of these medical institutions is also part of that genocide enablement apparatus. It allows for the erasure of Palestinian voices, and it allows for the normalization of these attacks on hospitals and medical centers, which are supposed to be protected by international law. We can go ahead and go to the next. So I'm kind of wrapping up here with this idea of the medical definition of genocide. Genocide, as it is currently defined, is a legal definition. It requires a few elements. I'm not going to get into the details, but one of them is the intent to carry out acts of genocide with the intent to destroy in part or whole a group of people. So the legal definition seems to, it has spurred a case at the International Court of Justice brought about by South Africa. South Africa raised the case of Gaza to the ICJ and requested intervention. Courts are really, really, really slow. I mean, this is not the antidote to genocide. I don't think a court has ever been responsible for the prevention of acts of genocide. And so a group of doctors have really started thinking about this, an initiative by Doctors Against Genocide and some legal experts in the UK have kind of come together to propose a medical definition of genocide, which is really focused on enabling and supporting healthcare workers as in their roles as protectors to the right of health, the right to health and to life. And it focuses on these healthcare workers as actors in the early prevention of genocide. So reporting on things, we shouldn't have to wait for a court to declare genocide before being able to say like, hey, I'm witnessing genocidal acts, and being able to activate pathways to support the prevention of these acts. So as it stands right now, there is really no mechanism for healthcare workers to report on human rights violations or to mobilize resources. I just returned from a month-long mission in Gaza again, a couple weeks ago. And having witnessed war crimes myself, there is very little support received by healthcare workers who are witnessing these things, who are recording these things, and who are talking about these things. And there's no official mechanism. I basically have to reach out to lawyers and say, hey, would you like my testimony? I was at Nasser Hospital last month on March 23rd, when it was bombed by Israeli occupation forces with no warning given. I was working in the emergency department, and the second floor of the hospital was bombed. Um, at the time, with all of the chaos and confusion, we began readying ourselves for a mass casualty incident. But there was this sense of fear that, like, what are we supposed to do, right? We are a hospital. What are we supposed to do if we get bombed again? Where do we go? There is no guidance. There are no rules. Israel will target a hospital once, twice, three times, not tell anyone, not issue any evacuation orders. So really, it kind of served to emphasize not only the lack of protection, but the lack of accountability, the lack of punishment for this very overt war crime. And it's kind of brought to mind, or it's brought kind of front and center this issue of how healthcare workers can act as human rights defenders in the absence of external support. Let's go ahead to the last slide. So kind of my closing thoughts on this. Healthcare workers and their duties are protected as enshrined in international humanitarian law. The whole focus of international humanitarian law and its genesis was the protection of healthcare workers, right? The protection of the wounded and the sick. The idea being that anybody can come to any healthcare center at any time, and regardless of political affiliation, if they are sick or wounded or injured, they are entitled to health care and they are entitled to protection while they are under care. Protecting healthcare workers is particularly important because they, in turn, can directly advocate and protect other people, right? They can protect the people that they care for, and they can protect the population around them. Unlike protections for people like journalists or other aid workers, this is something that kind of has a magnifying or an amplifying effect. And historically, there's no robust way to do that. So it kind of behooves healthcare workers themselves to think about how they can do this, and how they can activate other healthcare workers to kind of lean in and support and advocate and hold accountable. So I guess the last couple of points is, these concrete examples. There is a lot of conversation right now about healthcare reconstruction in Gaza. And there is an emphasis on, or there seems to be an emphasis on NGOs providing reconstruction. And what really needs to happen is kind of flipping the script and saying that, like, yeah, NGO help is definitely valuable and definitely needed. But the Ministry of Health and Palestinians should have agency, should have control over healthcare, because at the end of the day, like, this is their territory, this is their turf, these are their patients. Things like resistance to blockades, resistance to the idea that healthcare workers can be abducted, can be tortured, advocating for things like the release of Dr. Hussam al-Busafiyya, the release of Dr. Khalid Assir, the release of all healthcare workers who are currently abducted. And resisting this idea of an aid paradigm that has emerged and is spearheaded by Israel at the moment. that Israel should be in control of all aid that goes in for future reconstructive efforts, but also control over these NGOs. And what they are asking for now is for like rosters of personnel that are employed by these NGOs so that they can be vetted by Israel in order to do their humanitarian aid work, which obviously poses a huge problem, right? It's like you cannot invite a party to a conflict to have control over the ways in which relief is provided. So those are kind of my last few thoughts. Thank you for bearing with me. It's a little bit long. I tried to fit a lot into a very, very short amount of time because I'm obviously excited to hear from Caesar and Emily.
Appreciate you, Tammy. As Tiffany said earlier, sorry, Dr. Ford, my bad. Please send your questions to the chat or directly to our wonderful TAs, Veronica and Megan. And Emily, if you are ready, you're up. Tough act to
Right.
follow.
Yes, Tammy is always a tough act to follow. Always feel very privileged to know her and operate in the same spaces that she does. Go ahead and share my slides here. All right, is that showing up for everyone? Or did you get a thumbs up? All right. So, as was mentioned in the beginning, a lot of my career has been in EMS. And so I've seen the opioid epidemic and the overdose epidemic evolve in multiple different ways. And I've also worked in public health. I worked for a syringe service program. So obviously we did a lot of focus on overdose education, and now working as a public health analyst. I will just quickly give the disclaimer that my current opinions, this presentation does not reflect that of my unnamed employer. And with that, we'll continue here. So I wanted to talk about Good Samaritan laws, and particularly the criminalization of drug use, the criminalization of asking for help. And while the title may be a little bit tongue-in-cheek, maybe a little hyperbolic, saying bad results for Good Samaritans, depending on who you are and for whom you're asking for help, the outcomes can be less than ideal. So quick overview here. I'll breeze through what Good Samaritan laws are. We'll talk about how they changed with the overdose epidemic. I'll talk about some of their variability by state, jurisdiction, and even the individual police officer someone may be interacting with. And then I'll also touch on some best practices. So just very quickly, sometimes I forget when I am in other public health spaces that I'm not necessarily in a public health space focused on drug use. So just a very quick drugs 101 here, if this is new information. When I'm talking about opioids, I'm talking about a synthetic opiate. So some chemically or pharmaceutically manufactured form of heroin. So that could be oxycodone, Vicodin, fentanyl, carfentanil, any of those fentanyl analogs. That's what an opioid is. Stimulants would be things like crack cocaine or methamphetamine. Xylazine is something that we're seeing adulterated in the drug supply. Xylazine is a veterinary tranquilizer drug. Benzodiazepines are a central nervous system depressant commonly used for anxiety. These would be things like Klonopin or Xanax. When I talk about polysubstance use, either intentional or unintentional, sometimes people will use drugs in combination with each other. So they may use an opioid and a stimulant, but they all may also do so unintentionally. One of the things that we're seeing kind of driving the overdose epidemic right now is the combination of opioids in stimulants. So opioid naive populations are becoming more susceptible. Talking about an overdose, usually we use that in terms of, or in conjunction when we're talking about opioids. So someone becoming unconscious, unresponsive, hypoxic due to central nervous system depression. But you can also overdose on stimulants as well. It's important to keep that in mind. And then I'll also reference naloxone. You may have heard it also referred to by its trade name Narcan. It's just an overdose reversal agent. So if someone has taken an opioid and it has caused the breathing centers the part of our lizard brain, our brainstem, that keeps all of our basic functions going. It's caused that to shut down. Naloxone can reverse the opioid receptors in our brain and get us breathing again. So keeping that in mind, we'll talk about the origin of Good Samaritan laws here just very quickly. They were initially introduced in California just prior to 1960, and the original conception was that governments were hoping that doctors would stop at roadside accidents. Automobiles were becoming bigger, more popular at the end of the 1950s, beginning of the 1960s, so there were a lot of crashes going on. And doctors were concerned that if they stopped and helped someone and they inadvertently caused an injury, there could be some sort of legal or financial repercussions for that. And so various governments across California and then across the United States implemented Good Samaritan laws that said if you stop to help someone in good faith and abide by these rules, you cannot be held legally or financially responsible. And that legal framework that it's under is there's a duty to assist versus a duty to rescue. So in certain situations, if your life is put at risk and you are not currently working, so my experience as an EMT, if I'm off duty, I can choose to help whether, or as opposed to me being on duty, I have a duty to rescue someone. There also has to be the concept of imminent peril. So if I don't act, something immediately bad will happen to this person, or if someone else doesn't intervene, something bad will happen to the person in question. There's also the obligation to remain. So if I respond just as me, just as Emily, on the street, let's say, and I reverse an overdose, I have the legal obligation to remain there with the person until 911 arrives, assuming that I have called 911. There is also something it's called without the expectation of remuneration. Basically, I'm helping you without the idea that you're going to pay me. If I help someone with the idea that they're going to give me $20 for helping them out, all my protections are, as a Good Samaritan, are washed away. There's also the question of consent. So if we help someone who is unconscious, they're not able to give us consent. If I help a child who is under 18, they can't give me consent as a child to help. And so consent laws under Good Samaritan frameworks are also something we take into consideration. And then there are also, of course, considerations for first responders that get a little bit more tactical that we don't need to discuss right at this juncture. So this number here, 283,765, that is the number of people who died from an opioid overdose between 1999 and 2015, when the first Good Samaritan fatal overdose protection law was put into place. So over the course of 16 years and almost 300,000 lives, there was no adapted Good Samaritan law for people who were going to respond to an opioid overdose. Naloxone, Narcan, the drug that reverses an opioid overdose, has only recently, within the last, I would say probably 7 or 8 years, become available and readily available over the counter or at no cost to a lot of people. And in 2015 to 2017, that's when we started to see states implement easier naloxone access laws to surround that Good Samaritan fatal overdose protection. And when I'm talking about these different waves of opioid overdose deaths, in 1999, that's when we had the overprescribing that is frequently mentioned. So people were getting way more pain medicine than they needed to. That was ultimately leading to them becoming both physically and psychologically addicted to these medications in some cases. Then when they were cut off by doctors, when doctors said, oh, hey, Purdue Pharma was lying to us. Actually, this medication can be incredibly harmful if not taken correctly. We saw the move into use of street drugs, mostly heroin. And then we saw the synthetic drugs starting in about 2014, 2015, depending on where you are in the US. And the synthetic drugs, those are going to be things like fentanyl, carfentanil, fluorofentanyl, all those analogs. And right now we are in the fourth wave. It's, the CDC, not entirely up to date here, but fourth wave of the opioid and overdose epidemic is that polysubstance use. So either intentionally or unintentionally, someone using an opioid in combination with a stimulant and then subsequently suffering an opioid overdose fatality. There are some good things that are happening, though. We've gotten provisional data, it's been checked, and we're pretty confident that this past year was the first year since 2018 that we've seen a decrease in fatal overdoses. So going from about 114,000 down to about 88,000. So it's roughly a 24% decrease in fatal overdose deaths. Certainly, there's a lot of different investigations we need to do as to why exactly this happened, what public health and public safety measures were put in place that caused this dip. But for the first time, we've seen a really big reduction in overdose deaths. And so as someone in public health and as someone who has, worked in EMS and is tangentially still involved, this does give me a tremendous amount of hope. And I think a large portion of this is naloxone saturation, so naloxone being more available and people becoming empowered to use naloxone with their friends and family. It is, I couldn't tell you how many overdoses I've responded to as an EMT, definitely over 100. But who is saving the lives of the people who are overdosing? By far and away, it is also people who use drugs. They are the ones who are saving these tens of thousands of lives. They're the ones saving their friends, their family members, people they may just encounter on the street. So while we do have to give our kudos and our thanks to public health efforts, it in no way compares to the efforts that are actually being done by people on the ground and people who are using drugs. So when we talk about Good Samaritan fatal overdose protection laws, which I'll just call Good Sam laws from now on because the acronym is much too long, it gets incredibly complicated. There isn't just one federal law that says if you give someone naloxone or if someone is overdosing, you can help them, you will be absolutely fine, nothing will happen. As you can see on this chart here, color-coded by a bunch of different states. I currently work in Wisconsin. So in Wisconsin, if me as the Good Samaritan, I call 911, I am protected, but I am not protected from arrest. So a cop could still arrest me. I just can't be prosecuted. I can be brought to jail. If it's on a Friday, I'll be held over the weekend until I can see a judge on Monday morning. So there are significant implications for that, even if I don't end up being prosecuted. What if I have kids that I have to take care of? What if I have a job? Those are all things that are very real situations for people. So even if it doesn't result in a prosecution and something on my record, there are very real consequences that enter into that criminal legal realm. And then the person who is overdosing is not protected. So they don't enjoy any of those same protections. They can be arrested and they can be prosecuted. So you can see that variability across the United States. And something you'll see on these maps here that sticks out, Wyoming and Kansas are always going to be the two outliers. Those are the two states in the US where there are no protections for Good Samaritans. There are no protections for people who use drugs. Nothing supporting harm reduction in those areas. So it's getting even more complicated now. If I am involved and I call 911 for my friend who's overdosing and I'm on parole, what happens to me? Well, if I'm in the state of Wisconsin, they can revoke my parole or probation. If I'm in the state of Illinois, there are protections for people who are on parole or probation. And you can imagine people would probably be more inclined to call 911 and say, hey, I need an ambulance. My friend is overdosing. Even if they are on parole, if they know the cop's not going to do a warrant check on them or a parole check. Whereas in Wisconsin or any of those other states that are colored in red, if it means me going back to prison, I may be more hesitant to call and ask for help if my friend is overdosing. And again, you see our good friends, Wyoming and Kansas, standing out again in gray. So let's add another layer of complexity onto this here. Why not, right? It's already complex enough. So we're looking at Good Sam prevention laws and then individuals who are eligible for additional protection. So it's dividing this into whether or not protection is for medical assistance or protection for an overdose itself. So you can see just the variability between these different states here. So I'm up in Wisconsin again, and it's only protection for individuals seeking medical assistance. And oh my goodness, would you not believe it? Still complicated. Some states limit the number of times that a person can call 911 to report an overdose before they get into trouble. I don't know the exact numbers for all of these states. I know in the state of South Dakota and then in the state of Texas, it is 3 times. I don't know what the numbers are for Iowa, Ohio, Tennessee, and South Carolina. But, let's say it's overdose number 4 that you've witnessed. Now police can start arresting you or start imposing charges in these states. So it's an incredibly complicated legal framework that, takes a 70-page policy analysis to work through. And so I think a lot of that is by design. We try to make things very complicated for people who may not have access to certain portions of the legal system. And so that's one way that people can be continue to be criminalized in efforts to save themselves or save their friends. And this is something that frightens me working in public health right now. There are certainly a lot of things that concern me, but working in the area that I do right now, this is what frightens me. And it's something called drug-induced homicide or drug delivery resulting in death, DIH or DDRD laws. And they were originally designed to kind of go after cartels. So the laws were made in the late 1980s, early 1990s. And it was, like I said, to target cartels. So if cops could tie the drug that someone overdosed and died on back to a criminal organization, this was a way that they could then prosecute that criminal organization, somewhat similar to RICO charges. How it's being used now is that co-users are being charged. So if me and my friend Joe decide to use drugs together, both of us as consenting adults decide to do this, and I'm the one who purchases the drugs, even if I'm not, a quote unquote drug dealer, and I share those drugs with my friend Joe, Joe overdoses and dies, I can be held legally responsible for his death. And the sentences for these vary by state. Wisconsin is unfortunately one of the hard chargers when it comes to prosecution on this. There were 2 people who were just recently sentenced, 1 to 12 years and 1 to 15 years in state prison because they were using drugs and their friend died. They certainly, of course, did not have the intent for their friend to die. And even if they provide life-saving measures through naloxone, the law still will apply. So you can see there are far more states that are colored in that have these drug-induced homicide or drug delivery resulting in death laws. And this, even more than gaps in Good Samaritan law protections, gives me great pause and great concern when we're talking about best practices around Good Samaritan laws. So just a quick comparison here between Wisconsin and Illinois. So like I said, in Wisconsin, I have protection from prosecution, but not arrest. Again, no parole or probation protections. Again, only the protection for the person who is asking for help. And we do have these DDRD laws. In Illinois, props to a lot of the harm reduction agencies and public health advocates who have gotten protections for people both experiencing and witnessing the overdose. And it's been a huge lobbying effort by public health and harm reduction to also get this the same implementation through parole and probation protection. And as of right now, there are no drug-induced homicide or drug delivery resulting in death laws in Illinois. If this is something that you are interested in public health, definitely keep your eye on it. If you see something coming up in the state legislature session or you start hearing some talk about it, the best advice I can give you is jump on it and jump on it quickly. So I guess we'd talk a little bit closer to the actual topic of fugitivity. How can I protect my patients? So going back to my role as an EMT, there are certain things that I am required by state law to report to police. It's very limited, but there are certain things that if I observe happening, I have to make a report. So if I think a child is being abused or neglected, there is no legal wiggle room. I have to make a report to police. Same thing for elder abuse or neglect. This also includes vulnerable adults. So this could be someone with Down syndrome, someone with cerebral palsy, anything that would put someone in the category of a vulnerable adult. Domestic violence, I also no wiggle room for me to report whatsoever. If I have a patient and I suspect that their significant other has harmed them or they tell me that, I have to report. Sexual assault and rape, also I have to report to law enforcement. I do always make it very clear to my patients that while I have to make this report, they are under no obligation to speak to law enforcement if they don't want to, but it's just something I have to do. And then dog bites. There are some very strange public health measures around dog bites and vaccinations. But what you don't see on this list here, oops, sorry, I went too far there. What you don't see on this list here is an overdose. If I respond to a call as an EMT for an overdose and I reverse the overdose, get the person in the ambulance, they're coming around, their oxygen saturation's getting up, getting some information from them, the cops show up. I'm under absolutely no legal obligation to tell that cop, hey, Joe overdosed. If I do tell the cop that, that opens up my patient to some potential criminal liabilities. The cop's going to want to know, where did Joe get the drugs? Is Joe on probation or parole? Who else is on scene that he can interview? Whose name can he run? So on and so forth. So what I have done typically, sometimes cops get there before EMTs, so there's not a whole lot we can do. And in some cases that can be helpful. Some cops carry naloxone, and the quicker you can get there and reverse an overdose, the better chances there are for survival. But if I have a cop ask me, hey, what happened here? And it's an overdose, I'll just say, hey, difficulty breathing, unresponsive, we've checked them out. We've gotten things going, we're good. I don't need to volunteer any incriminating information to the police. There's already kind of a blending of job roles between EMS and law enforcement, unfortunately, at least as viewed by the public. We kind of wear similar uniforms sometimes. Maybe some departments require you to wear an EMS badge or a fire department badge. And so I always want to make it really clear in the past to my patients that I'm not there as a police officer. I don't care what you've taken. And also, there's no law that says you can't dispose of drugs for someone. You've got a sharps container in your ambulance. There's nothing that says I can't, sneak that in there for them if the cop's going to show up. So that's kind of where I think of fugitivity as going. Certainly, for like boots on the ground EMS work. There's a lot to reflect on from this. And, I could argue it from a bunch of different angles. But as I said, overdoses are going down. The majority of that has to be attributed to people caring about their friends and carrying naloxone, giving it to people in need, giving agency and power and respect to people who use drugs, recognizing them as autonomous individuals. We in public health and public safety are not saviors. And so our role should not be that in these situations. So things to reflect on. I think that's what I got from this presentation, or got from the ability to do this presentation. I'm very glad that Caesar reached out, and glad that Dr. Ford and the TAs were able to help facilitate this. If you do have any questions, that's just my personal email. Please feel free to reach out. Even if it's questions not related to this presentation, if you have questions about harm reduction or EMS or, public health in general, I'm happy to answer any of these questions. And this is just one of my my favorite pictures, and I think very relevant to fugitivity. So be careful with each other so we can be dangerous together. And with that, I will turn it over to Caesar.
Thank you so much, Emily. Really appreciate you. And wow, I'd seen the slides before, but it was a lot more than I expected somehow, even. Like I feel like you really broadened our minds to a lot of stuff that's going on. And I feel like this is directly just just generative, useful things for everyone on this call to know, especially the folks that are like trying to get their degrees or thinking about, going into medical school or in any of these kind of adjacent fields, which we have a lot of overlap with. So I am going to go ahead and roll right into my slides so that we can have some time at the end for some questions. So let me just get it warmed up here. Okay. All right. Can everybody see these slides materializing in front of us here?
Yes.
All right. Excellent. Okay. So I got into public health in 2020, really. So a lot of my thoughts about masking are from the last decade or so, but it turns out that there's like actually quite a lot of history around the subject, and as far as like legality and as far as it being criminalized and who is the subject of this carceral behavior. I want to give a quick shout out to the Death Panel podcast, which definitely inspired me to really think about this topic and go deep. And I highly recommend people check it out. I've got a QR code near the end of these slides to get you into it. But for now, let's just let's go through a little walk in the history books on masking in the U.S. So all the way back in 1845, there were a group of farmers who got tired of being abused by big capitalists, and they put on these funky masks, as you can see in the lower left corner, and they did some crime, allegedly. And that led to New York's anti-mask law, which was actually repealed, at least partially, in 2020 because of COVID. Um, so this and other topics, again, you can get a lot more detail in if you go to the Death Panel podcast or if you check out some books on the topic. Specifically, this book, Arresting Dress, really gets deep into how trans folks have been criminalized for cross-dressing, or with these anti-mask laws that they have had in California as well. That I think there's maybe somewhere between like 12 and 18 states that have had some form of anti-mask law on the books. And a lot of them were based around masquerades and based around people's attempts to hide their gender. And so these like anti-mask laws were really kind of going straight for the throat, even like hundreds of years ago, going after people who were standing up for themselves, going after poor farmers, going after trans folks. Um, and then, of course, in 1918, we had the big Spanish flu, Spanish in quotes because actually it was found here, but similar to how whenever there was a new variant of COVID and it would get picked up in South Africa because they have such a robust surveillance system. This is the reason why people kept, associating like Delta or Omicron or whatever with South Africa for a while. But Spanish flu seems to have stuck, even though it was not really about Spain. But that was our big pandemic that happened in the last 120 years or so. And at that time, masking became a thing, anti-masking became a thing. As you can see, they had a funny little moniker. They would call people dangerous slackers for not wearing a mask, which is kind of cute in a way when when you're not thinking about the hundreds of whatever, tens of millions of people who died from it. Kind of miles when you put it in that way. But yeah, the photo on the right is also some young folks who would wear camphor and little pouches around their necks. So there was like various ways people were trying to like fight against that pandemic. The radiators were also said to have been really useful because radiators, they produce a lot of steam. They make your house a little too hot, so you leave your window open even when it's cold. And that ventilation also helped people kind of mitigate COVID a bit. And even though this is mostly about masking, I want to touch upon other things while we're going through the Kansas flu, yes, such as like other mitigation efforts, and also really broadly the through line throughout this entire thing is the solidarity that masking has become inextricably linked to, and how it just kind of reflects more broadly like how we need to, as just humans, need to be more cognizant of our impact on other people's health and how we need to work together to actually protect one another, despite our very American individual ideals. So there's some anti-mask laws that were about the Klan as well. This photo, I don't really feel shouting for it or whatever, but like I could not include it. Apparently, there were some Klan folks who tried to do a post-election rally or something in 2017, and this is, I guess, the results. So, but back in the day, there were anti-masking laws to stop the Klan actually from carrying out their terror campaigns and lynching folks. And so this is maybe one of the few sort of positive cases you can look at these anti-masking laws around, but even then it's very messy. We definitely do not have time to get into the legality of all this now, but I highly recommend people check it out. I'll definitely share my references later so you all can look up all of this good information if you'd like. So, masking as just a thing that happens in the world, um, not really super uncommon in parts of Asia, especially. It was really the US that was really like behind the eight ball when it came to masking and just having like no experience, not having any sort of awareness of the efficacy of it, and things that are still being fought in the media today. But Wong Kar-wai, who is a very famous Hong Kong director, has a few films that feature masks, feature people wearing masks when they're sick to protect other people from their germs, people wearing masks while they clean or while they're in any mixed company environments. So just added this in there as just a reminder that like this really was not such an alien concept prior to COVID. It is just that we were behind on it. So yeah, 2020. What a year, right? We could spend again, we could spend an entire semester just trying to unpack that, and maybe in the future I will. Um, but as you know, as we're all aware of, COVID hit, and our stance under the first Trump administration um, was very us versus the world. It was very much like close the borders, pointing the finger. Not a lot of science making it into the kind of like popular consciousness from the executive branch at that time. In fact, we could spend again another couple of hours just talking about all the various things people were being asked to try. And, we had a president that even with COVID wouldn't wear a mask. Uh, but from the start, unless you're going with the debated theories, it basically was the first spreading event was in Wuhan, China, and then before you knew it, we were just like leading the pack. So I I like this photo of Anthony Fauci. I'm sure whoever the photographer was thought they were being really clever with this like duality of man or whatever they were going with here. But it brings out to me my thoughts, which are very mixed actually. I feel like about Dr. Fauci. I mean, the 60 Minutes interview in early March, where people were basically told there was no reason for us to be walking around with masks, was an attempt to prevent a run on masks, which there were runs on everything from groceries to toilet paper, to protect healthcare workers. But in effect, I feel like it did some kind of irreparable damage to like the idea of masking in this country that we're kind of still dealing with today. Um, this is early March. Really it didn't take long before we were just immediately ahead of the pack when it came to like suffering from COVID. And the one thing that shocked me really going through this was how long we were using cloth masks. Like we were using cloth masks for years, basically. Um, and sorry, I admit. I also wanted to include this slide. So, our friend Dr. Fauci was on the Bodega Boys show. Rest in peace to the Bodega Boys show. The two homies are still out there, but we're talking about like a very popular show. We're talking about two of the most beloved, like Black and a Dominican man in like mainstream kind of comedy culture. Having Dr. Fauci on, and at the end of the show you get to share like one message with the world and they put it up in lights. Like this would be like the neon sign outside of your bodega or whatever. And so like even then, this is late March, we're still going with the hand washing. We're still not, the masking is not breaking through at a time when definitely Black and brown folks really needed to be hearing about, hey, make a mask, find a mask, get a mask, wear a mask. But we were still struggling. We were still in the dark ages there a bit. This is a slide from, I think it was the John Hopkins contact tracing training I did or something in 2020. But but in here, masks being used to reduce transmission was included, and it is in the literature. It has been in there for a while, despite the fact that we had all these debates and we had all this reasoning behind like why not to mask. Uh, and then before we even really got fully into the masking stage, just when we were at the social distancing, like maybe stay at home if you feel sick stage, um, there was an immediate cultural split, kind of a real kind of two Americas moment where we had folks really literally out here willing to risk their lives for Baskin Robbins or like just for the idea of being told that they maybe should stay home for a week was enough to just absolutely like turn this country like upside down. And this was even before we got into the popular uprisings around police killings, which I could not talk about 2020 without getting into to some degree. So these are just some popular tweets and memes that I saved from May of 2020, which was really a time. Um, I don't know if folks remember, especially if you were part of the Chicago response. But really early on, we knew that Black folks were like disproportionately being impacted, and as soon as we started having testing and other resources available, again, it was there were inequities. There were as my friend Beth would say all the time, they were put drive-through testing facilities in neighborhoods where most people didn't drive, and then wonder like why the Black folks were not getting tested as well as the white folks. And so we had a lot going on. We had a good old Islamophobia happening in France. We had just we are not over 2020. We are definitely not over 2020. I feel like I was in my feelings going through this as though it was yesterday, and I don't know if I'll ever be over it. But yeah, at some point, this incredible photo was taken, which I feel like really kind of sums up the entire year. This was, I think, a California wildfire happening in near a senior center in 2020, and yeah, soon as it got warm out, as soon as people just had finally had enough. Just one too many Black folks was getting killed, and so uh, the whole damn country lost their mind. Like, but in some ways good, some ways bad, I would say. Um, from Chicago to Baltimore to Minneapolis, they burned down the police station, and like that is not a normal thing that happens very often. Like, more's pity, but still. Um, one story that really resonates in my head when I think about solidarity is so Central Camera, as you can see in that bottom right photo, um, is like a beloved institution in Chicago. Like I said, since 1899, right? So it was a casualty of the uprising, but the owners of Central Camera were not upset at the people who damaged the store. They like people in Minneapolis when like car dealerships were getting set on fire. And a thing that I felt like was underreported was how willing people were to be like recognizing that this was a moment in time that was important and recognizing that the lives being lost were more important than the property damage actually. And so they did not admonish the people who damaged the shop. And I really feel like it's a lesson that a lot of us could take in being less concerned about personal injury to ourselves and more about like the fabric of our communities. Chicago police really lost their damn mind. I mean, people, as you can see, we had huge crowds of people out there, masked in solidarity with each other, trying to keep each other safe while also wanting to be out in the street to stand up for what was right. And I had people with trucks trying to run us over, cops trying to beat our ass everywhere we went, cops pointing friggin' grenade launchers at children. Like, like it was a real a flashpoint, I feel like, in the 21st century that again we'll probably be unpacking for the rest of our lives. Um, and it was also a moment where I feel like the alignment of public safety and public health really kind of started to coalesce for me, at least. Again, as like a baby public health person in 2020. Um, just there's just so many moments, and I had to include best black dad on television ever, Avery Brooks as Captain Cisco from Deep Space Nine, who there is an episode in which he goes back in time and actually becomes a revolutionary, which to me, I still think is pretty damn radical for Star Trek. But it really, it really, these moments really brought home for me like how important it was for people to stand up and actually put their lives on the line to go out there and say something about what was happening. Um, and yeah, it was really all over the place. So, in Chicago, movements for everything. There's a rent control movement that occupied one of the Picasso statues. We had us trying to tear down the Columbus statues. You know, and we had, I think this may have been the first time I remember seeing the Chicago mayoral apparatus start lifting these bridges up as like what I see really as a form of structural violence, honestly, just like restricting people's movements for the sake of public safety, and utilizing salt trucks, which I still think there's a lot of work to be done to maybe talk to the salt truck drivers and I've asked a few of them, but I want to know really how do they feel about basically being turned into cops like every time there's a protest. They're the ones who are blocking the street. You may as well give them a badge like they're out there every time. This is just it's hilarious artistic construction that also couldn't let 2020 go by without revisiting. So Protect Chicago was the public health effort that the Chicago Department of Public Health, in conjunction with UIC and Malcolm X and Sinai and so many folks put together, and that I was a part of, to really get out there on the street, get into the communities that were being impacted, to give people masks, to give people tests, to make sure people could get vaccinated in next year in 2021 when that finally happened. When all this is going on while like, this sticker was on a gas station really close to my house back in 2020, and I've seen them all over the place, and it just it's a reminder again that there was a lot going on like in the zeitgeist in this moment. There was a lot of confusion, there was a lot of mistrust, some of it was warranted, and there was just a lot of just wild out there thinking. Yeah, I just deaths surpassing 100,000 like feels like it's hard to like conceptualize it when now that we are so far past a million. But there was definitely a moment, and it was actually studied in a paper that basically said that how many lives we could have saved if we could have done universal masking, or if we could have had a stay-at-home period that was across the nation and not just in a certain few like blue enclaves. And it's kind of an alternate reality we'll never be able to explore, but I think it's a good question worth looking into now that we are in this reality post 2020. I won't say post COVID because COVID is still out here trying to get us, in which public health ability to actually give us advice that must be actually listened to is like deeply under threat, and was under threat before 2025 and this new administration. Laws were passed to restrict public health institutions' ability to even do mask mandates again. And so the negative solidarity of the death making institutions that really are the moneyed like backbone of like the power structure in this country have been hard at work trying to keep us from replicating these moments from 2020. And I think really the 2020 uprising was the moment in which mass became inextricably linked from anti-capitalism, linked to anti-capitalism, linked to abolition, linked to solidarity with oppressed people all across the world. And now we are living in this reality in which you can't separate the two. And I think it's important for people on whatever side you fall on to recognize that. And especially if you fall on the side of wanting to actually deconstruct these these institutions, if you fall on the side of want to protect your community, people really need to understand how important it is masks are, not just as protection from COVID, but it's also protection from surveillance, also just in solidarity, also in making the space comfortable for people who are disabled or immunocompromised to be in it. And it is a thing that really has fallen apart over the last few years. And I think it might be the key to us. I don't know, keeping this struggle going. So let me move on to the next here. So Halloween 2020, again, what a moment in time. The Dr. Fauci socks. Yeah, the what more can be said about these Halloween outfits? Uh, yeah, just it was the strangest year in my life for sure. So the end of 2020. Wow, we've got Democrats back in power. They're even wearing masks on stage. I feel like there was an opportunity here for things to go one way, for us to maybe, you know, really start bending that curve as we were supposed to. And unfortunately, we kind of went the other way. So I also can't really go past 2020 without revisiting this rogues gallery of people who are now in control of all the public health infrastructure were active agents of death during 2020. We have the people who are running the Medicare facilities, people who are running the FDA and HHS were out here trying to basically convince people that convince people in Jay Bhattacharya's case that I don't know, fat people should pay more because reasons like that Dr. Oz was out here trying to convince people that it was okay for like children to die, for the sake of the economy, using words like appetizing. Just I don't know what can you even say about it. Um, but yeah, the threat was there, and unfortunately, we did not rise up to meet it in time, and now we are kind of living through what we're living through. And yeah, and then 2020 ended, but COVID just kept going. So in kind of very famously in May of 2021, the CDC director very publicly on TV, on YouTube, on all over the place, said that basically if you were fully vaccinated, you did not need to wear a mask anymore. And so, for those of y'all who remember, like how this evolution of COVID has gone, this is before Omicron. This is before the lion's share of deaths of COVID actually in this country. Um, and even in 2022, when we were really in the middle of it, still, somehow the mask emoji was not found on their keyboard. Um, and so, again, what is the reason? What is the reason? Is it the uprising? Is it the rise of a surveillance state that really needs to be able to see our faces? I don't know. Um, Speaking of solidarity, I've been thinking a lot about like why one of the first things that happened in this new administration was a break from the World Health Organization, and I couldn't help but think that maybe the fact that solidarity is actually a pillar of what the World Health Organization thinks we need to actually survive climate change, to actually thrive and become healthier, may have some part of that. So in 2022, this was for me like a big shift. Having been, in Chicago, living through mask mandates, knowing that you had to wear a mask here, you had to wear a mask on the train, you had to wear a mask indoors, you had to wear a mask to go to a restaurant. And all of a sudden it was like, don't hate the people who are wearing masks still. And I was like, wait, how do we get from you have to wear a mask to like, it's okay to wear a mask to like, please, like, don't kill the people who are wearing masks. Like, they may have a reason or whatever, as if not wanting to get COVID and not wanting to potentially be disabled or killed by it was not a good enough reason. But this is where we found ourselves in 2022, excuse me. Um, Thankfully, we made it through. And this photograph, I think, is actually from 2020, but it reminds me personally of what it felt like to be in a lot of spaces wearing a mask in 2023, actually, because in 2023 we were fully over it. It felt like unless you were in a struggle, or unless you were, and even if you were a healthcare worker, I was saying so many folks just over it, not wanting more boosters, not caring about masking anymore, not caring about testing anymore. And I can't fault them necessarily about this, because a lot of this was because our infrastructure completely evaporated. It was dismantled. Everything that we had grown accustomed to became much more difficult to access. And so we found ourselves in a place where masking largely became a personal choice, which anyone who knows how masks work, that is not how they are most effective. So in 2023, we also saw as Tammy got into the the genocide entering an extremely active phase, beyond the mowing the lawn horrible analogy that the Zionist Agency uses. It became just far too real, and another moment, another 2020 like moment occurred where the streets were filled every day. It didn't matter, snow, cold, dark, night, rain, college campuses full of people acting in solidarity with each other, taking care of each other, seeing maybe for the first time in their lives like what they could accomplish without these like outside kind of capitalist kind of structures. And again, I feel like this was a big threat to a lot of people, which is why um, the masking, it continues to be seen as a threat itself. This is a moment from the U Chicago encampment where a lot of folks actually lifted their keffiyehs to protect the praying folks who were praying from looky-loos, and there were like right-wing vloggers and stuff like kind of flocking to college campuses to like record people's faces. This is what solidarity looks like in like an image right here, you know. Lakeshore Drive, like just so many beautiful moments. We were out there, south side, north side, it didn't matter. So getting into the actual criminalization, the reviving of centuries old laws, the just rhetoric about how everyone who wears a mask is a criminal, really kind of kicked into high gear in 2024. Like multiple mask bans have been passed. Um, I believe that this ban is specifically, yeah, Long Island. And then there's also North Carolina. The entire state of North Carolina, I think, is now under a mask ban. The Long Island one was like a specific part of New York City, I think. And each of these really should be studied in and of itself, because they're all operating under like different like methods and reasonings for why they chose the language, for why it was Nassau County instead of, you know, whatever. And so the mass bans uh, are now not just a threat at the state level, at the county level, at the city level, potentially at a national level now, given the administration that we have now and what they are currently engaged in. Um, so yeah, a lot of news is actually thankfully picking up on exactly the reason for why these mass bans are happening. They have tried to pin it to criminals. They have tried to sneak it under the radar as things that are only going to impact people who are doing crime, or as an escalation, or as an additional add-on to a sentence for someone who commits a crime. But really, what is it about? It is about stopping people from being in the street, protesting a genocide, and wearing a mask. In 2024, at the American Public Health Association conference, walking around Minneapolis, I saw this lovely box where someone just I don't know, some group of folks probably built this so that they could share mass with their community, and it just, I don't know, it makes my heart like really just like pump a little faster whenever I think about it. Um, I can't really talk about masking and COVID without talking about long COVID again. Like, it doesn't matter how strong you think you are, getting COVID repeatedly over and over again is really terrible for you. And lots of people have not recovered, and they may never recover. We are, none of us, I think, fully the same person we were prior to COVID, but for some folks, it's a lot more severe. Uh, that bottom left photo is actually a photo when we were basically unable to talk about the genocide on the floor, despite many efforts to get the American Public Health Association to speak out about the genocide. And so when we were basically rebuffed, once again, unable to even get the measure to pass a simple vote so we could talk about it, there was a silent protest essentially, and that's I'm very proud just to know any of those people in that photo who allegedly were there. So here we are in 2025. We have a lot of folks out on social media trying to like really let people know why it's important to keep masking. This is not something you're probably going to hear from your doctor or even from your public health institution. You're very unlikely to hear a health department tell you to wear a mask, I feel like these days, unless you are, I guess, a farm worker. And even then, because bird flu seems to have gotten a little quiet at the moment, maybe it's run its course to the bovine herds. But yeah, it's really kind of up to us to actually to take control of our own lives and to protect each other. And so that solidarity is has never been more important. Uh, so for those who are not aware, the Trump's demands to the Columbia University supposedly to like free up their funds involved the mask ban, which they have agreed to. Um, so we are watching levers be used in ways that we have not seen before. We are watching new escalations every day, and masking and Palestine solidarity has never been like, more of a hot button topic. So like yesterday, I think a friend of mine shared this with me. So apparently like at least this particular Panda Express location is not allowing their employees to wear masks anymore, claiming that because they provide a warm, welcoming, engaging environment, people need to be able to see your facial expressions. So you should risk your life, maybe get sick, I don't know, half a dozen times a year, so that your smile, like, rings out for the customer base. So like, I don't know, I don't even know what to say about that, other than what we really need is to enshrine our protections, our abilities to wear masks, uh, uh, in a way that is not going to be at risk from the next company that decides to do this or any sort of national bill. So again, as I mentioned before, the Death Panel podcast is really an incredible source for information and knowledge. It 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 has inspired me. It has educated me. And it's definitely a big part of the reason why I just chose to talk about this topic today. And you'd be hard pressed to find a group of people less interested in solidarity. Let me say that. Uh, Additionally, as far as resources, if you want to know what it's like to protect your community through masks, so a mask block is essentially what happens when a community of people get together to collect masks, to provide masks, to help people gain access to them without having to go broke, since masks can be very expensive. And so checking out either one of these QR codes will get you to the Sick Times and the Mass Block Oral History Project. There are mass blocks here in Chicago and all over the country. So if you're in need of mass, you should definitely look local and figure out, who you can get into. And go have maybe one more thing. Oh, we can actually wrap up the recording.